If you're diabetic and want to do everything possible to make sure that you don't die from being diabetic, then this video is definitely for you. Hello, I'm Dr. James Bogash and publisher of Modern Health Myths. Today we're going to talk about a factor that's incredibly important in managing diabetes, but not one that is frequently talked about. So let me start this with an example. It was a patient that I had in the past couple months, a little bit before the apocalypse hit. And this particular patient was diabetic, and he had two things going on with him. First of all, he was on multiple medications, but two things off the top of the bat, or top of the the list that were not being addressed were his oral health and his sleep apnea. Those are two factors that until you get a grip on them, you will not be able to manage your blood sugar. So his doctors were treating him and medicating his diabetes without actually addressing things that had a massive impact on his blood sugar. So it was kind of like, trying to put out a fire with a spray bottle. It just wasn't going to help until you got those fixed. Unfortunately, like I said, his doctors had not discussed that, and this was the first conversation anybody had with him about needing to make sure he got his CPAP machine fixed and working, and that he started taking care of his oral health. So when we talk about oral health, we're going to talk a little bit about a study that was just published on periodontal disease and how much of a major risk factor it was for diabetic complications. That meant things like diabetic retinopathy, so problems with vision, death, which is an outcome we'd like to avoid, and as well as neuropathy, so um, problems with the nerves. So these are people that are diabetic. These conditions, these problems like heart disease, nerve damage, eye damage, are all part of the package that goes with um, and sometimes not even poorly controlled diabetes, but just diabetes in general. So they looked at what effect periodontal disease had on these complications, and it sent them through the roof. So basically, for eye problems, diabetic neuropathy, it increased it almost, depending upon the numbers, anywhere from 200 to 800 times risk of eye damage if you had teeth problems. For the neuropathy, it anywhere from tripled, so 300 plus percent up to 600% increased risk of having neuropathy. As far as cardiovascular complications, keep in mind that most diabetics die of cardiovascular complications. Those risk increased anywhere from 128% to, sitting down for this one, 17 times the risk, so 1,700% increased risk of cardiovascular complications in diabetics who had um, uh, periodontal disease. So should have mentioned, as far as the range of this goes, the reason there's ranges is because this was a meta-analysis looking at a variety of studies, so that's kind of the range of what, but that's massive. As far as increasing risk 17 times just because you're diabetic and you have issues with oral health. Like, that's through the roof. And then as far as death, which is an outcome we all want to avoid, anywhere from 230% increased risk up to about 850% increased risk. So overall, there's a strong relationship between having poor oral health and periodontal disease and bad outcomes with diabetes. Unfortunately, these we've got the dental realm and we have the endocrinologist primary care realm, and a lot of times they don't cross. And they need to, because doctors need to understand that you are never going to fully manage diabetes unless you manage oral health. The nice thing is that a lot of our dietary choices also improve both the microbiome, the oral bacteria we have in our mouth. I'm a big fan of tongue scraping, making sure we get all the extra bacteria and fodder or fuel source for bad bacteria to grow. I do believe there's a role for xylitol-based gums in in controlling or changing the oral bacteria. And obviously not smoking is a big issue. So all of these things are important for managing good oral health. You take better care of your oral health and your gums, and you're going to have better outcomes from managing your diabetes. So, as always, make sure you like this channel or like this video, share it with somebody who you think needs the information, and subscribe to the channel.